Okay, today I'm going to see a boy. He's 11 years old. He's had warts on his right elbow for about 2 months. He has one big wart over here, and he's got multiple smaller ones here. Today what I'm going to do is the large one I'm going to excise, and the smaller ones I'm going to treat with liquid nitrogen. Okay, so what I'm going to do first is anesthetize this area. What I use for that is xylocaine, 1% with epinephrine. Okay, I put on the gloves. They don't have to be sterile, just clean gloves. Okay, next thing I do is prep the area by cleaning it with alcohol, rubbing alcohol. Okay, next thing I'm going to do is anesthetize the area with the xylocaine with epinephrine. I usually like to do is inject right underneath the lesion, so I make a little bleb underneath the skin like this. You see where it's starting to swell up? And let it just sit for about 30 seconds. Although the xylocaine works pretty quickly, almost immediately. I'm using a number 4 curette and using a hyfricator. I set it on high about 40 or 50. I'm using it on the high setting over here, and any between 30 and 50. I usually like to test it first to make sure he doesn't feel anything. Feel that at all? You feel some pressure, but they usually don't feel any pain. And the next step is let me put this way. Okay, and I take the curette, number 4 curette here, and then I just scrape off the lesion. Usually if you soften it up first, you can scrape it off in one shot. So it comes off. That's it. Then what I'll do now is just electrodesiccate the base to stop any bleeding and treat of a deep root if there's anything in there. But usually once you see bleeding, you know you've gotten the whole wart out, because there are no blood vessels in warts. So it means you're underneath the wart. We go to the tank where we keep the liquid nitrogen. Have the liquid nitrogen, then the histofreeze is a good secondary choice. And for the smaller ones, I'm going to treat them with liquid nitrogen. What we do is we take 2 Q-tips like this. Okay, for these small ones, we then take liquid nitrogen. I press it over the bumps for about 3 to 5 seconds until a small white frost will form around the lesion. I usually repeat it about 2 times like that. It hurts a little bit. It's like putting cold ice against your skin for a few seconds. So I want that white frost around the area. And what's going to happen in about a day or 2, hopefully this will turn red. You're creating a burn. It'll form a blister, and then it'll break and then just peel off. Although sometimes you have to do liquid nitrogen a second time in a 2 weeks period, depending how deep the root is. Right now what I do is put a little dressing over the area that we burnt off, or scraped off. And I'll put a little bit on the others we froze. Oh, okay, I just put on some polysporin ointment, or we use triple antibiotic ointment. Okay, then we tell the patient in the morning he's going to take off the Band-Aid. We're going to give him some rubbing alcohol to clean the area, put some more ointment over it, and cover it with another Band-Aid. We have them do it for about 3 to 5 days. When I scrape it off, we'll form a scab in about 3 to 5 days, and that'll peel off in about 2 weeks. And the small ones should form a little blister in a day or 2, and then just peel off within a week. That's it.